Mission Hills, Kansas, asked on Facebook, I have been diagnosed with breast cancer. What are my options for reconstruction after my mastectomy?
So Hope, I'm very sorry to hear of your recent diagnosis. Your options actually are very extensive these days now that we have immediate reconstruction for breast cancer. Depending on your diagnosis and the exact plan for treatment, your options include immediate reconstruction with implant or your own body tissue. Sometimes we do tissue expander placement. If the surgeon plans for radiation postoperatively, sometimes we will opt for delayed reconstruction. In delayed reconstruction, you often use either a tissue expander or your own body tissue to rebuild the breast. And the body tissue can be taken from the abdominal area, from the back area. Once a tissue expander is completed expanding the skin that may have contracted after a mastectomy, we can put a permanent implant in, and this is an example of a permanent implant. They're shaped like the breast. They can be small or larger than this, and typically when they're in the body, it sits like this without causing as much rippling as the older type of implants that we had. This is a textured implant that is basically about a B cup size, and we take the size that the patient needs based on their preoperative evaluation. This is another type of implant. This is a silicone implant, which is round, and this, if put in the body, can show some rippling. So that's why we've made the newer form-stable implants for breast reconstruction with the texturing and the shape. So the options are very much more expanded now than they were years ago. The immediate reconstruction has become a really popular thing with tissue preservation, with skin, nipple, areola sparing mastectomies becoming more popular and on the forefront. Immediate breast reconstruction at the time of the mastectomy has become much more popular. If your surgeon and your plastic surgeon agree that this is a good option for you, women love to be able to wake up with a breast after having a mastectomy, and I think that's one of the most remarkable things that's available to us today.